Welcome to The Data Pulse, a data-driven health podcast breaking down key health trends and insights in South Carolina. Brought to you by the South Carolina Department of Public Health. Visit dph.sc.gov/SC Tracks. Better info, better health. Here's your host, Tony G.
Welcome to the Data Pulse, a program that breaks down key health insights and what they mean to you. You can find all the data you need at dph.sc.gov/tracking. Again, that's dph.sc.gov/tracking. Better info, better health. Today, we spend some time with Chaunte Rodgers. She's the senior consultant for WIC at the South Carolina DPH. We'll talk with her right after this.
Are you looking for accurate data for school projects, grant applications, or business presentations? SC Tracking has that. Go to dph.sc.gov/SC Tracks. SC Tracking tracks state and county level data. It's easy to get started. Visit dph.sc.gov/SC Tracks. Better info, better health. Brought to you by the South Carolina Department of Public Health.
Joining us today is Chaunte Rodgers, a senior consultant with WIC at the SCDPH. On today, how are you doing, Chaunte?
I am doing well, Tony. Thank you so much for asking.
Good, absolutely. First of all, before we get into the conversation, why don't you tell everybody about yourself, where you're from, who your peoples be, and how you got involved with the South Carolina Department of Health?
I am Chaunte Rodgers, and I am actually from a small community called Britain's Neck, South Carolina, in the PD area of Marion County. And so I've been in Columbia for well over 25 years now. Came here as a student at the University of South Carolina and just got comfortable in Columbia and made it home. I've been with the Department of Public Health now for almost 3 years, I think. Might be a little bit more. I lost track of time. So maybe close to 5 years, actually, but with WIC, almost 3 years. And ended up here just before the pandemic and started out in communications for 2 years and then moved over to WIC as the senior consultant.
All right. So tell us about WIC, because I mean, that's something that a lot of people talk about, even though they may not know exactly what WIC is or what it does. That's what we're going to talk about today. Tell us, first of all, what WIC is and how it benefits families.
Certainly. WIC is a supplemental nutrition program, and what it does is provides access to nutritious foods, as well as nutrition education and breastfeeding support and healthcare referrals. We support low-income pregnant women, also new mothers and infants and children up to the age of 5. Basically, the program helps to ensure that women and children have the nutrients they need to thrive during critical early stages of their life.
So it really is meant for women, pregnant women.
It starts with pregnant women. When a woman is pregnant, to make sure that that baby is getting the nutrients that he or she needs when the mom is carrying that child. Now, sometimes, and I was going to mention something about this later, Tony, but sometimes there are fathers who may think, oh, I can't apply for WIC because I'm not a woman. However, fathers who have custody of their children, they can apply for WIC for the child to make sure that the children that they have the nutritious foods that they need. Okay, so you say ultimately it's really about the child. Ultimately, it's about the child, making sure that that child has the food that they need to be healthy.
Okay, so with that being said, let's talk about the requirements and how easy it would be for a family, a mother or father.
So eligibility for WIC is based on your income, whether or not you are at nutritional risk, and also, of course, it matters where you live. And families must meet certain criteria, such as income guidelines. They have to meet income guidelines, which generally is about at or below 185% of the federal poverty level. So you have to be a resident of South Carolina if you are applying for WIC in South Carolina. I remember doing outreach once, and there was a mom who actually worked in South Carolina, but she lived in Georgia, and she wanted to know if she could apply for WIC, but she could not apply for WIC because she was not a South Carolina resident. So applicants must live in the state where they are applying. And you can also be at nutrition risk to qualify for WIC, which means you may have a medical condition like anemia. And if so, the doctor can give you a referral. And with that referral, you can also qualify for WIC. And again, if you're pregnant, You can get WIC if you're postpartum. You could get WIC, and also, again, if you're an infant or a child up to the age of 5. And sometimes people think, well, I work, so I can't qualify for WIC. Well, that's not necessarily true, because you can make, let's say, you can make $70,000, Tony, but because your family size may be large, you could qualify for WIC. So let's say, for instance, this is an actual number. Let's say if you make $77,000 a year and you have a family size of 6, well, guess what? You meet that income requirement and you could qualify for WIC.
Chaunte Rodgers talking with us today. She's a senior consultant with WIC, and anything you might be thinking about WIC, hopefully we will get on the table on today. One of the things that is clearly, there are a lot of misconceptions. We just heard one that fathers probably think that they cannot qualify, and in fact they can, depending on the situation. What are some of the other ones that are out there, misconceptions that people may have about the WIC program?
Sure. Like you just said, dads can apply for WIC for their children. Also, foster parents. Foster parents play a major role in helping a child develop. And so they can apply for WIC for the children that they are responsible for, as well as grandparents. There are a lot of grandparents who raise their children. And so, of course, legal documentation has to be given to us, but you can also apply for WIC for those children who are in your care, and also other legal guardians as well. And
what is because I want to go to the long-term benefits, but is there in fact there's an age limit? Is there an age limit for the child?
There is an age limit. So once that child reaches 5 years old, they graduate from the WIC program.
Gotcha. Is there something else that follows, by the way? Is there something else?
There is not anything else with the WIC program, but there are other services that are available to families so that they continue receiving nutritious foods.
I gotcha. All right. So let's go back to the long-term benefits. Once somebody is in the WIC program, what are the long-term benefits of that person or for that person as they experience the program itself?
So WIC has been shown to have long-term benefits such as improved birth outcomes. So WIC helps to reduce premature births and low birth weights, as well as infant mortality. And there's information that you can find out about those reproductive health issues on our website at dph.sc.gov/tracking, where you can find out how the reproductive health is in our state. But with WIC, you can help to reduce those premature birth rates and those low birth rates and those infant mortality rates. Also, it helps with better child development. Children in the program tend to have healthier growth and development, which reduces the risk of chronic health conditions later on in their life. And also it reduces healthcare costs. So by addressing nutritional needs early, WIC helps to reduce long-term health issues, resulting in lower healthcare costs for both families as well as the society. So, you stay out of the doctor's office. You stay out of the doctor's office, which means you have lower health bills, right?
Right.
It also improves educational outcomes. So children who participate in WIC, they're more likely to perform better academically due to having better nutrition during those crucial early developmental stages. A child goes to school hungry, guess what? They're not going to perform so well. But if they have the foods that they need, they end up performing better academically.
Senior consultant for WIC, Chaunte Rodgers, joining us today to talk about the WIC program. Breastfeeding mothers, we're going to give you some information next. Don't forget to stop by the SC Tracking website and find their dashboard called Reproductive Health. All right. You can find it at dph.sc.gov/tracking. More with Chaunte in just a moment.
It seems like data is everywhere these days, but is it reliable? Data from SC Tracking is both accurate and reliable. It's easy to find, easy to use, and has a guide to help you find the information you need. Visit dph.sc.gov/SC Tracks. Do you want to compare health conditions in your county to the rest of your state? SC Tracking tracks that. Maybe you're concerned about air quality where you live. SC Tracking tracks that. Or maybe you're interested in rates of different types of cancer in your county. SC Tracking tracks that too. Visit the SC tracking website at dph.sc.gov/SC tracks and try it out. Better info, better health. Brought to you by the South Carolina Department of Public Health.
Chaunte Rodgers, Senior Consultant with WIC over the SCDPH. We are talking to her about WIC and their services and programs. Don't forget you can find better info for better health at SC Tracking, the website, dph.sc.gov/SC Tracking. That's dph.sc.gov/SC Tracking. And one of the dashboards on the SC Tracking website is called Reproductive Health. Now, you can find information, for instance, on how much better well-nutritioned kids do versus ones that are not. And one of those things that help lead that effort in better nutrition is breastfeeding mothers. Let's talk about that a little bit.
Sure. So WIC offers breastfeeding education to help new moms understand the benefits of breastfeeding and how to succeed on that journey, because it really does become a journey for some moms, especially when it's new to that mother. We also have peer support that we can provide to mothers in the areas that they live in. So we have breastfeeding peer counselors, and their moms also who breastfed their children, so they understand what that mother is going through when she's trying to develop the habit of breastfeeding her child. We also offer breastfeeding pumps. So a mom can get breastfeeding pumps from the clinic, and we loan those pumps to them to help them with that process of getting the milk from their breast. And we also have lactation consultants, Tony, who offer one-on-one support to the mothers as well. Because a lot of times moms will start, they'll start when they're in the hospital, but when they get home, it seems to be, a little bit more challenging for them.
Right.
So by having that breastfeeding peer counselor, that kind of helps to keep the mom a little bit more confident while they are going through that journey of breastfeeding.
And the reverse of that is a lot of times they actually have a hard time even starting. So to your point of having people that can help them through that process, that's a good thing too.
Yep, help them through the process and give them some tidbits on, things that they can do to help them to be able to get milk, because sometimes it's because, the milk is not coming, or maybe they feel like it's not coming fast enough. And so those peer counselors can help them, to share some tips on how they can kind of make that process a little bit easier.
Chaunte, before we let you go, let's talk about a little bit how the program itself has evolved. At least let's talk about it since you've been there. I mean, where was it when you started, and how much has it evolved since you've been there?
Yeah, and I'll tell you, Tony, so last year we actually celebrated 50 years of WIC. So WIC has been around for 50 years, helping families across this country. And it's so amazing. I'm sure people who can think back to 50 years ago when they were first having children, like when my mom had me, WIC started out with vouchers. And so you would go in the grocery store with your voucher, shopping for your food, and get to the register and have to present this voucher. And the cashier would have to, make sure you have the right products by going through the list of grocery items that's listed on your voucher. Well, now we have an eWIC card. So you go in the grocery store and you can just swipe your card to pay for your groceries instead of having the voucher. And it kind of takes away that stigma also, Tony, by, going in with a paper check, this paper check that we used to have. But now you have a card that looks like your debit card, and no one knows that you actually have an eWIC card and not a debit card.
Gotcha.
One of the things that we have since I've started on the program is we now have the online pre-application. So you don't have to go inside of the office. You can actually begin the process online by uploading the required documents that need to be presented to our office, and go online to apply. So the link is dph.sc.gov/WIC pre-app. That's where you can find the pre-application. Also now, thanks to the pandemic, you can you have the option of hybrid appointments. So again, you don't have to go into the office for your appointment. You can actually do your appointment over the telephone. So we're glad to have that option, especially for moms who work. It makes it a little bit easier for them to not have to take time off work, but they can actually schedule their appointment perhaps during their lunchtime to see someone in our WIC department. We also have a mobile app So when a mom or dad or whomever, grandparents, foster parent, when they are shopping for their groceries, they can use their mobile app to actually scan the item. Let's say if they're shopping for cheese and they scan the item, and the app will tell them if that's the product that actually qualifies for WIC.
Chaunte Rodgers, Senior Consultant with WIC at the South Carolina Department of Public Health. Thanks for joining us today.
Thank you so much for having me, Tony.
And that's going to do it for this edition of the Data Pulse. Don't forget once again to find more information at dph.sc.gov/SC tracking. That's dph.sc.gov/SC tracking. Better info, better health. We'll see you next time.